Okay, it is 3 o'clock, so welcome everybody to COVID-19 Talks with Rogerio and I don't know, I don't have a title, so uh, it's the COVID-19 Thursday afternoon event. Um, so we have been doing this for 2 months now. The idea came when I found out, and many other people heard, the president calling COVID-19 the Chinese virus, and I became incensed by the lack of sensitivity there and by the very clear stigmatization of something that it shouldn't be stigmatized at all. And that's how we began this conversation 8 weeks ago. And the conversation has evolved and has become, very interesting with many people joining sometimes and some people who join every single week, which also has been really nice to see it. So the conversation has evolved from COVID-19 and its impact on people individually, its impact on organizations and communities, and more than anything, we have begun to talk about identity and how some kinds of identities in some geographic locations can together come together to influence the impact of COVID-19. So we have talked about populations in New York City. We had talked about New Orleans, and we also had one that was directly related to, I'm getting forgetful. So New York was the first, and then we had
Detroit, and then
Detroit, and then had New
Louisiana
Orleans.
generally. New
Yes,
Orleans and Baton Rouge.
in Baton Rouge. And today we have special guests from Newark, New Jersey, people who I have known for many, many years and have worked with in Newark as well. And so we will be concentrating on that geographic location, which is today the second in terms of number of COVID infections in the country. In the Navajos nations, since a few days ago, has become the third, and Detroit falls, somewhere beyond that. So clearly, the virus has affected many different peoples, many different communities, and all of us have been affected in different ways. And so today we are going to be concentrating on all sorts of identities that will surface during the conversation. So I might sometimes ask very specifically about a population or another, but we are going to be following the flow of conversation from the guests from Newark. So again, I am Rogerio Pinto. I am a professor at the School of Social Work at the University of Michigan. I am also the Associate Dean for Research there. And I am doing this supported by the Faculty Allies for Diversity. My co-chair, Eddie Weaver, usually is here by this time. Maybe she won't be able to join us today. But the affiliation of the Faculty Allies for Diversity also includes Trina Shanks, it includes Todd Horencall, it includes David Cordova, and it also includes Lorraine Gutierrez. Thank you to Larry Gint, who is the director of our Diversity, Equity, and Inclusion program for the school as well. All of those people are, supportive of this event. They have been since the very beginning. So before I start with the Newark conversation, I'm going to ask everyone, and I have been doing this for the past few weeks, just to be quiet and give a few moments of silence in respect to those who have perished due to COVID-19 in all regions of this country and across the world. So let's just give it a moment of silence, please. Thank you all very much. As I do every week, if you look at the chat box, you will see the names of the guests for today. I am not going to be listing each and every one of you, but I will be calling on all of you. And because one of our guests, we were not sure that she was going to be able to make it, so her name is a little further down on the chat box. So when you see Letisha McBride, who is at the bottom of the screen, she is also one of our wonderful guests. Something very interesting happened in Newark not too long ago, and Warren, one of our guests, sent to a bunch of people that we know in common, many of them guests here today, about something that was very interesting happening in Newark, where the mayor there decided to test for COVID-19, if I understand, the entire homeless population, and a nice, very nice, and they also said that people who, tested positive would be in quarantine. So this was a very bold move that I think, everybody should be doing if it works for each one of those schools. But I think this is very interesting as a start of the conversation, which is about action, because for many weeks we have been exploring how we feel, what the disparities are connected to COVID-19. But last week I decided to begin a conversation that will lead us. How do we come back from this? How do we ramp up the university? How do we come back to work? What are the actions that need to be taken from schools, universities, personally, the government, and so on and so forth, so that we can begin to reconceptualize what life is going to be beyond COVID-19. And I say this very carefully, not to say go back to normal. I do not believe that there will be, life again the way it was before COVID-19. But that's also part of what we can talk about here today. What does it look beyond COVID-19, and what do we need to do in order to get there? So that's the last thing that I'm going to say before I pass on to Liliane Windsor, who is a very good friend, a beautiful colleague, who is living for the year in Washington, D.C. for a fellowship that she's doing in there. But she actually lives in Illinois, in Champaign. But she's today in Texas because of COVID-19. And we both of us actually were born in Brazil, in the same city. So I'm going to ask each of my guests, when I call on you, to say who you are, give a short introduction, and then introduce us to the subject that you are aching to talk about. So Lili, that it goes to you.
Thank you, Rogerio, and thanks everyone for the opportunity. Before I get started, can I just ask Nick a favor? Because Eric just sent me a text and I don't know what the phone number is to call. So I wanted to ask Nick if he can text Eric and give him the phone number, because he doesn't have enough.
Yeah, can you enter his number in the chat?
Yes, I sure can. Okay, thank you. All right. So I wanted to start by explaining a little bit about who the NCCB is. We are a group of researchers, practitioners, and consumers of health who have been working together for 10 years now in the city of Newark, with the goal of improving health, reducing health inequalities in the city. So Newark used to be my home, and it's going to continue to be my home and my heart forever. I think it's an incredibly resilient city that has faced a great amount of challenges over the decades, and it never quite recovered. And then now finally, it had been improving a bit, with some gentrification and some challenges there as well. But at this point, I do have some faith that the current mayor is someone who is very close to the Newark very well, and who has his heart in the right place in his decisions to be testing the population. My understanding is that they're using city funds for the most part to cover this effort. And a big preoccupation is because of the disparities in people who are getting the virus at this point and dying, who are predominantly African American. And Newark is a predominantly African American city. New Jersey has been hard hit by the virus right now. Today, they have 133,000 cases in New Jersey, with a total of 8,800 deaths. And Newark is overrepresented as usual in terms of the COVID. This is also true for many other diseases, with 14,000 confirmed cases and 1,200 deaths. Right along with Bergen County, which is also a kind of a neighboring county to Essex County, where Newark is located. And the NCCB has been doing work predominantly with vulnerable populations in Newark. The mayor is not planning necessarily on just testing the homeless. The idea would be to test everybody if they could afford, but knowing that the tests cost anywhere from $100 to $150 each, they're not going to be able to afford to test the entire city. So they are starting with the premise of working with the vulnerable population first. And that includes the people that are high risk for acquiring COVID, and then people who are older, people that have comorbidities and are hence at higher risk. And then starting with people that have less resources and then growing out into the populations. And my understanding is that they just opened up testing sites where you have to call, make an appointment, and then you come in to do some of the testing. I will not take much of the time talking because my colleagues and the co-speakers are the ones who are on the ground in Newark right now, and I think that they can share their perspectives and experiences much better than me, who are not in Newark. So I'm going to send it back to Rogerio.
And I'll send it back to you in a few moments. So NCCB is the Newark Community Collaborative Board. It's a board composed of researchers and practitioners and community residents, and so that's what Lili was talking about. So I'm gonna actually move from Lili, and I'm gonna ask Warren to talk to us about what he's seeing in Newark, but also, if possible, to comment on what Lili said in terms of the test costing $100 to $150. And how do we, and maybe we can start the conversation with Warren, how do we feel about having to pay for the test? Maybe some people can, some people can't. And if we people who have $150 to pay for the test might be able to help other people get the test for free.
Sure. I'm actually somewhat relieved I'm going early, because once you get warmed up with your probing questions, it's going to get tougher than that question right there. Yeah, so my name is Warren Thompson. I'm currently a professor at Rutgers in Newark, the Newark campus. We have not been allowed on campus, I'd say, right before spring break, the week before that. So maybe like first week of March is probably the last time I've actually been in Newark. I've lived in Newark for years, but I moved about 5 years ago. So I'm in a town that's probably 15 minutes from Newark. One of the things I know that you were speaking about, the disparities, right? So Newark has a number of hospitals, and there's a lot of reports coming back that these hospitals are not equipped with the proper PPE. They don't have the right testing. They're overcrowded. They're just not really in any kind of condition to service the community the way that they really should be serviced. And what you see is the towns that surround Newark that are wealthier towns and they are a little higher on the socioeconomic scale. Those hospitals have a tremendous amount of resources, right? So even when an individual tests positive for COVID, depending on where they're able to go and to get treated, that's going to have an impact on the end result as well. The school situation is interesting. You know, we had to all of a sudden get thrown into this remote learning world. And I think that the students have shown a tremendous amount of resilience. The students on the Newark campus, you have a lot of minority students, you have a lot of even second generation immigrants that are students. A lot of them, this is the furthest anyone in their family has ever gone in a formal education. There was a lot of issues on, do they have the right technology to even perform this sort of learning? And for the most part, I've really been inspired by you know, some of the stories and some of the cases I've seen. I don't know where we're going. I mean, we've gotten the directive to teach all summer online. I have no idea what it's going to look like in the fall. You know, and as you spoke earlier, Rogerio, you had me thinking, what does a social distancing safe classroom look like, right? We're getting reports that because of the finances, they're trying to cut classes and combine them. So if it was a class that typically would have 25 students, now they want you to teach a class that has 45 students, right? But what does that look like if you're going back in a classroom? I mean, if I'm teaching 45 students online, that's one thing. But if I'm back in a classroom, you know, is that going to be more risk involved because now you have individuals at such close proximity?
And I'm assuming even if we have the 6 feet distance, we are assuming everybody is going to be wearing masks, right?
Masks,
I mean,
right.
are we to assume that?
Right, I would assume it as well. I mean, even you know, standing in front of the classroom teaching, I would think you should have a mask on at this point, right? So it's like you said, that's our almost forecasting what does our new reality look like. As far as the front line stuff really going on in Newark, I mean, I still have a lot of colleagues in Newark. I'm constantly in communication with them, but I really almost would rather hear from like a Lisa, Eric, and Darris that are actually out there doing the work, so they could give us a good understanding of, you know, what is the climate out there. I like I said, I have not actually been in Newark for at least 2 months right now, you know, because of the social distancing. But I do stay abreast of what's going on in there. And you know, as Lili said, that it's a good step. I was speaking to the owner of the largest shelter in Newark, and she said that yesterday they came in, the health department came in, the Newark Health Department, and tested everyone in their shelter. Yet we also know that there's this underground homeless population, right? That they don't live in the shelters, right? They're living under the train tracks. They're living in parks. They're living, you know, and how do you get to them? How do you get to them and convince them that this is something that, you know, needs to occur? So, yeah, there's a lot of social issues that are occurring right here that, you know, we're trying to stay abreast of. And, you know, kudos to those on the front line that are actually, you know, putting on masks and strapping up and going out there and, you know, interacting with these individuals.
I'm going to move to Lisa for a moment, but I want to go back later for all of us to think about, you know, we talk a lot about testing, and testing, it only tells you the status right after you took the test, right? I mean, if you test negative, in another hour, you may be contracting the disease, right? So I would love for that to become part of the conversation, because as we begin to think about, you know, how does life look like beyond COVID-19? How do we go back to what we were doing before? Well, testing is one thing, but another thing that also happened is that we know that 30% of the tests are coming back, as false positives and false negatives. So how much trust do we put on the test is the other problem, right? So I wanna just park these questions that I'm asking now, and I'm gonna ask, and then to go back to it. I lost Lisa. Where are you, Lisa? I don't see your picture anymore. Because I wanna go back to Lisa and ask her what maybe I'll go to Letisha to talk to us about what she's seeing in Newark. But make sure that you introduce yourself first and you say your full name so that we know who you are. So I'm gonna ask you, Letisha, to just pick up on what Warren has talked about, and if you can explore further what it is you've been seeing in Newark, and if you could speak about this issue of testing as well from your perspective. But you need to unmute.
While she's doing that, I just wanted to note that Eric has joined the conversation. He's on the phone.
Oh, great. So I'll call on him after Letisha. Okay, Letisha, now I think we can hear you.
All right. My name is Letisha McBride. I was formerly working for NJCRI under Community Wise. And I just want to piggyback off what Warren was talking about. They are testing at Branchford Park. You don't have to pay. If you have insurance, any type of insurance, they're taking health insurance for any population. You just call this number. It's a 973-988-5511 number, and they set you up to come get testing. And they also have somebody that give you a consultation to find out what symptoms you have, and if you may have COVID-19 or you may not have it. This morning I called for my brother. I want to say this first, Mayor Raz Baraka. He's doing a wonderful job for Essex County. He is doing a tremendous, great job. He always on live at 5 o'clock. He's talked very well about the city. He's not only just getting the people that's inside of the shelters, Warren. They had an outreach team that combined to get together, and I was once a part of it, but because I don't want to get myself sick because I have high blood pressure, I have bronchitis, and I have asthma. I chose to opt out of the outreach program that they put together to go out at night to get these people that was underground and in the railroad tracks and wherever they sleep at. So these coalitions, they got together and going to get people that's sleeping outside to get tested as well. And then they're doing the senior citizens. So they do have Branchford Park that has people that have health insurance that can go there, call that number, and they will get you tested. They also have a number that if you don't have insurance, they have a 1-800 number. I don't know it off the top of my head, but it's written down in my room that I can give before we close, that they can call and get tested if they don't have insurance. And that's what the city is paying for. For the people that doesn't have insurance, they're paying for those people, those individuals. But for the most part, Branchford Park, you can call there and get tested. I haven't really been going out, but when I do go out, a lot of the young people, ages, I want to say 18 to 25, they're not paying attention to what's going on. They're not wearing masks. They're not wearing gloves. They're not respecting the curfew. And it's just a lot of people that's 30 and 40 and 50 years old. Every night they come on my block and break up the of people that's congregating, and just doing what they normally do like there's nothing going on. And they send patrol cars here to tell them to go home, and they give the time, but the only thing I could do is, let them know when I'm walking my dog, I say, you should put on a mask. You know, I even give them a mask. I give them gloves. You know, some of the clients from NJCRI, I go up there because I go to the store across the street from there and buy box of hot dogs, you know, food for my home. And a lot of them outside and they're hungry. You know, it breaks my heart because, you know, NJCR is not open to give them no type of help. You know, it's one of them particularly. I took them food shopping, you know, and gave them some food and came home and got some of my toiletries, some napkins and tissue and toothpaste and stuff and gave it to him, you know. But they're doing a lot of things in Newark to help the seniors and the homeless. I think they need to reach out more to people that's not homeless and not seniors, because some people are still dying and being depressed at their homes and they don't have no food because they don't have no, you know, they have welfare, they have food stamps, you know, they have 4 and 5 kids and the food is going out in 2 weeks, you know, and they're not able to eat. I can do my part, but I'm just one person. But I just want to say that they do have a lot of testing going on, but they just opened up Branchwood Park. They have Weekway Park as well. But Branchwood Park is for those that have health insurance, and then they have a 1-800 number that you can call for the homeless people or individuals that does not have insurance, like me.
Letisha, I love the way you talk very locally, right? I mean, it's almost like I can imagine the park and, you know, going to places that you're talking about, which makes it contextualize very much the kinds of things that we need to learn about. But I appreciate your bringing up the, you know, something that happened just about every week, which is how different groups of people have different kinds of needs. But I think the thing that you added to the conversation today, and I'm going to be asking Eric to comment on this, you know, in a second. I hope that Eric is listening to me.
Yes, I'm listening to Rogerio.
Okay, good. So just give me a second. I'm going to ask you a question because I want you to build upon what Letisha, you know, was talking about. There are different groups of people who feel or who have very different needs, including even within the houseless community, those who may be living in a place that is more difficult to access and actually reach out to them. So even when we have one particular community, the needs of that particular community can be extremely different. And even in the individual needs of different people can be very different. And I suspect that depending on those needs, for example, if you cannot move very well because you might have a disability, if you're not, you know, eating well enough, I mean, all of those things can actually conspire to make you, as a person, even more vulnerable, you know, to actually contract COVID-19. And if you have it, to suffer more from it. So Eric, I would love to hear from you. You know, what are your thoughts today? What are your thoughts about, you know, what Letisha just shared with us? And what's your own personal experience with COVID-19 today?
You know, she's actually very, you know, correct in what she's saying as far as the people outside, the elderly and homeless people that need help. Because, like, the situation that I'm in now, when they do lockdown on Mondays, it really hurts. Mm-hmm. You know, they have it where all stores and businesses in Newark are closed on Mondays, but it's kind of hard for a person that has to manage day by day their living not to be able to do it that one day. It kind of sets everything off, and like she said, there's some people that don't get to eat because I actually made a mistake and didn't get enough, and I almost went all day last Monday without eating. It was just so that I happened to have something like bread and peanut butter in the house, because I wasn't properly prepared. And that's the sad thing, because we can never be properly prepared. This was something that hit us over the head like Watergate. We didn't expect it. And it's kind of hard to do anything about it because we still don't know fully what it is.
So Eric, what are your major questions? I mean, what would you want to know? You know, what are the major questions that you think we are still asking and for which we may not have answers?
Well, no, I just want to know, like, in what kind of way the NCCB help towards people in those positions.
Mm-hmm. So Eric is referring back to the Newark Community Collaborative Board and ways to use the Community Collaborative Board as trying to resolve, some of the situations that we had. And we actually had a meeting a couple of weeks ago, and I'm going to make sure to talk about this because all of us need to be thinking about what's the next thing, right? Many of us may have sent money to places. Many of us may have volunteered to do A, B, or C. I find myself in a very difficult situation in terms of volunteering, not knowing exactly what to do because of physical distancing. It really takes away in so many ways what it is that I know volunteerism is about, right? I mean, you usually volunteer by going close to people who need something from you, and you try to help them access the things that they need. This has made it really very difficult to help that way. I remember someone a couple of weeks ago talking about Detroit and having a difficult time finding volunteers who would go to hotspots to distribute food. That they could, it was hard to find enough people to go inside of the buildings where a lot of elderly people live because people are afraid to contract the virus by exposing themselves to that kind of environment. So I don't want the conversation to become about the Newark Community Collaborative Board, but it might be interesting to think about what are we, as society doing to help the people who may need more help than we do. I think that's a question from, for all of us. And so I start by saying that, the Reverend who was here 2 weeks ago was asking for volunteers to make those deliveries. And I saw that Jeanette had her hand up. Go ahead, Jeanette.
Yeah, so one of the things that the comment about young people not necessarily respecting the social distance, I mean, I think especially for homeless young people, they are very communal. They survived as a community, right? One person has money and you share. So they are actually, in asking them to isolate, we are also kind of both keeping them not socially, but from all of the other resources. They really pool their money and kind of survive as a group. So I think it's been very difficult. I also think the original messaging around the virus was that if you did not have an underlying health condition, if you weren't elderly, that you were okay. And I think that stuck, and they're not, and especially since they are mostly with other young people, they're not around a lot of older people and seniors. So they're not as concerned about kind of passing it on to others. The scary thing, I don't know if you've heard, in New York, even though children aren't dying, apparently what they're finding now is that there is a group of children who are having longer term effects, and we never even knew. We might have thought that they were exposed and they didn't have it at all, but now there are symptoms coming up, and there might be long-term kind of lung and heart issues for children. Now that might make the whole world sit up and respond differently. Some of the Republicans who were saying, oh, some of the older people will have to die. I don't think they would be as cavalier about long-term health issues for children. So we might be kind of changing a corner in the messaging that makes people look at it differently.
We can always hope, Jeanette. We can always hope. Lisa, I had called on you before. I would love to hear from you and what's going on in your life and in Newark. And if you could pick up on this idea of, what can we do as we keep thinking about the next stage, right? I mean, are there enough masks to be wearing? How can we help younger people? I keep thinking about the HIV epidemic, and we still know one of the groups that keep, that where it's really hard to decrease the new HIV infections is precisely the age that Letisha was talking about, that, the 14 to 25, right? Because it's very hard for young people to adhere to very prescribed ways of preventing by wearing a condom, wearing a mask, wearing gloves, right? That kind of a thing. It's a population that has a very difficult time following those things. But I do want to, before I go to you, Lisa, remind everyone about the implementation of evidence-based practices. if you are interested in research related to nurses and physicians, consistently, every study that I have read that is about the use of gloves in, emergency room or surgery, and whatever the situation may be, nurses and doctors, by and large, 30% of them do not wear gloves consistently. So this is before COVID, this is the way it is. About 20 to 30% of nurses and physicians do not wear their gloves regularly in every kind of circumstances that they are supposed to. And one of the ways people get sick in hospitals and in medical offices is because of that. It's because nurses and physicians move from patient to patient, sometimes not wearing the gear that they are supposed to in regular times, right? Hopefully now they will. I only say that because these are adults and professionals who have a difficult time to do those things. So when we think about young people and children having to wear masks and gloves and everything else, we need to be much more creative about how we are going to cajole them into doing it. Simply tell them to do it is not going to cut it, right? I mean, we know that to say no to drugs doesn't really do anything, right? So Lisa, having said that, I would like for you to respond to me or anybody else who talked about before, but tell us who you are.
Hello everyone. My name is Lisa Gaskins. I'm a Newark resident. Also, I work in Newark at Integrity House as a drug and alcohol counselor. It has really been a great impact on that vulnerable population who I work with. When you talk about wearing the gloves and masks, first of all, when we started out, when COVID hit, so to speak, in the beginning, we weren't being tested. So once staff members and clients alike had contacted COVID, actually a client passed away at the men facility at Integrity. Also, the nurses contracted COVID, along with a client that was a client in my facility, which is a halfway house for women. So they had places set up where they would quarantine the client for the 2 weeks and retest them. We all now, fortunately, have been tested 2 weeks ago, and whoever tested positive was quarantined, and then we've been tested again 2 weeks later, because what happened was a client had tested positive, and we were still exposed to this client before the first test came back. So I've noticed in the young population, especially those who are 20 to 25, we wear masks, we wear gloves, we take clients' temperature regularly every day. I have to take my temperature when I come in, sanitize, wash my hands, and it's been like difficult to keep up with that practice, but I am so fearful, and it's a lot of fear. A lot of clients in that age group don't wear masks, and they want to come for a session, and it's like, it's very hard to adhere to the social distancing. What we did was we cut our group size down to 10. So that population was not taking it seriously. So we have to keep enforcing them that. And now that the client that had tested positive was 21, so they said that the young people can get it also. Another thing is that it's affecting that population because they're not able to attend outside 12-step NA and AA meetings, although they have been afforded Zoom meetings to still get the support that they need so that they don't relapse. It's a lot of the other level of cares that don't have cell phones and are not able to get the meetings, or H&I, which stands for hospital and institution, to bring the message into the treatment facility so that they have that support so that they will stay in treatment. So
Lisa, can I ask you to go even further there? Because this is one issue that has not come up in this, 2 months of conversation. People who are dealing with addictions, and As we also know, one of the ways to combat the use of drugs is by socializing with people, right? I mean, not only going to 12 steps programs, but you go have coffee after the meeting. It's calling your sponsor, of course, very often, but also getting together for fellowship and other things. So can you just elaborate even more? Because this is a population that we have not really touched upon. And if anyone after Lisa would like to comment on that, I mean, it would really be incredibly appreciated.
It has been very, the impact has been great on people in early treatment who are not able to have that socialization, that coffee, a meeting after the meeting, get together, because that one, that meeting after meeting, that cup of coffee can have an effect of helping keep that person clean and sober, and they don't have that. So they're sitting there isolated and they're in their own head, which is a bad place to be for someone, so that took a lot of that. And especially now they're not even accepting new admissions in the programs now. So the people who are seeking treatment can't even get into treatment that way, so it has really had an impact on the socialization of clients. Really need that that type of support on the outside. So yes.
Thank you so much. I mean, it's going to be interesting to observe this and to see if this it will be like a major impact of the shelter in place order, which is isolate yourself, which is the last thing that is good for people dealing with addictions, and then do not socialize, which is another one that is very complicated. It's not the same to do Zoom and to be in somebody's presence. Darris, I would love to hear from you, and then from you I'm going to go to William. I don't see William, but I'm guessing he's on the phone because I see his name as participant. Darris, could you give us your impressions of what's going on in that, and if you want to comment on any of the issues that we talked about, including the last one about sobriety in the face of COVID-19. So yes, tell us who you are and then give us your impressions.
Yeah, my name is Darris Hawkins. I currently work at NJCRI, but thanks to Lili, I was working in community wise, but now I'm in the drop-in center. And like the population of people that I dealt with while I was at community wise is pretty much the same, but that whole population is like, and before I go there, as far as the dealing with addictions and stuff like that, what I'm seeing is the Narcotics Anonymous and the people that run the Narcotics Anonymous meetings and stuff like that, just like we're having this Zoom meeting, they're having the Zoom meetings, and they are, keeping in touch with people after. They are doing a lot of different things like that. But back to this COVID-19 and NJCRI, I had COVID-19. I had COVID-19. Okay. I was at NJCRI the week before, and it's crazy. I really don't know exactly where I got COVID from, but I was at NJCRI the week before, but when my fiance came home from work a few days later, she had like an itchy throat, and she said she noticed that she had an itchy throat, so she wasn't gonna give me a kiss, and I said, don't worry about it, just kiss me anyway. 2 days later, she started like coughing and stuff like that, and then it was like the day after she kissed me, I noticed I had the itchy throat. So 3 days after that, I noticed like we couldn't smell, we couldn't taste, all our, it was like everything was thrown off. And then it was like the hot and cold flashes, the headaches in crazy spots in my head that I never had a headache before. Felt like I had needles and nails and stuff in my nose. Whenever I tried to inhale and take a deep breath, I couldn't really breathe from my nose. So that was so scary. And then when I went to get tested, when you were speaking about testing and stuff like that, it's like I went to see my doctor. My doctor gave me this prescription to go get tested, but where she sent me, I couldn't get tested till the following week. So they gave me another number that I could call and get tested in. And I don't live in Essex County. I live in Middlesex County. So it was kind of, I want to say, easy for me to go get tested somewhere else because of where I'm at, my geographical location, I guess. I don't know. But anyway, I got tested and, but wait. When I went to my doctor immediately gave me antibiotics and the things dealing with flu symptoms and stuff like that. So that's what really helped me like come back from it so fast. So when I went to get tested, I didn't find out I had it till days later. And me and my fiance have different doctors. So when she got tested, her doctor was out because it was Passover week and you know, he was out of the town, he was out of the country or something like that. I don't remember exactly where he was, but he wasn't in his office. So they sent her somewhere else. But they told her to wait and take the antibiotics after she got tested. Now, because I took the antibiotics right away, I got better a lot faster than she did. And it was like, oh, those symptoms were undescribable. I wish this on nobody, but my concern is this. When like they said they're gonna, like I just went back, today is my first day back at work. So they said they're gonna put me on the schedule for next week. And then they're supposed to be doing like a trial run starting on the 27th of this month. And my concern is, like I even went as far as like after I was clear, I went and got the antibody test. And I'm waiting for my doctor to call me back, which should be tomorrow, to let me know if I have the antibodies in my body to help or whatever, however that goes with that. But I'm
Darris, can I ask a question? Because I'm curious and I'm pretty sure a lot of people may be. So I have not been tested. You know, my partner and I have been assuming that both of us have the virus because you know, we put, you know, we protect ourselves if we go outside. You know, David, when he goes to the supermarket, he wears, you know, gloves and he wears, I mean, really assuming that we have it because, and then take all the precautions so that we don't give it to someone else. But how did you feel knowing that when you, what does it mean to you to know that you had the virus?
Rogerio, it was so scary. I have children in the house with me. Me and her was in this room. I was on the bed, she was on the floor. She really took the social distance thing to another level. She was on the floor, I was in the bed. I had one son in the living room and I had another son in the bedroom. Every time we went outside, because we have a bathroom and everything over here where we're at, so they have their own bathroom out there. But every time we went out this door, we had to have masks on, we had to have gloves on. We made sure we was protected. We wiped everything down out there. So that's another thing that I'm concerned about. Like they said I'm okay to go back to work, but they also said that being that I've been tested already, even if I don't, like they don't know if I can continue to spread this out. But or
if you are immune to it, that we don't know if having it.
Right. So, but what I can say is, the last few days, maybe like 6 days, I've been going out there around my children without the mask because, like I said, we did our quarantine process and now our symptoms are gone. We're feeling much better. The doctor said everything is okay, but we were still concerned. But like for the last 6 days, I have been going around the kids. Everybody's fine. You know, nobody's saying anything about it. So, you know, I guess it's okay to go around people after all your symptoms are gone. I'm hoping it's okay. But again, my kids are fine. So, but my concern is me going back out around people may have it, and you know what I mean? And working in that population, it's just, I don't know. It's gonna be different. And just like you said, like life as we know it is never gonna be the same. Everything is gonna be different now.
So what I hear you saying for all of us to think about is how social norms are changing and how they will solidify, right? We don't know. I mean, even good friends that I walk with. So yesterday I walked with a very good friend, and she was a little closer to me than she had been in prior weeks. You know. Yeah. So from 6, it's getting to be 3. You know. So I'm very curious to know how we will begin to create individualized plans of protection based on our capacities and also based on what's available to us, right?
Right.
I have not been, wearing gloves too much because I don't go out very much. I only wore masks, once because I'm usually 6 feet apart and I'm outside, so there has been no need. But I cannot imagine that it is very pleasant to have a mask on all day long as we begin to think about going back to work or going back to school or whatever those situations are. And I saw that there is a lot of conversation happening on the chat in terms about, who's doing what, how the classroom is going to look like and that kind of a thing. I want to, thank you, Darris, for bringing a very personal way for us to think about and the complications of being in a home with more than one or two people, right? I mean,
right.
And the fear of having it and the fear of exposing other people. I would like to call on William, who is one of our guests as well. William, can you hear me? And can you come on and share with us where you have been in terms of COVID-19? And you can respond to some of the things we talked about, or you can bring up, anything new. So I'm giving it to you, William.
Okay, Rogerio. Yeah, so my name is William Hempstead. I've been with the Newark Community Collaborative Board for about 2 years now. I'm also an adjunct professor with Essex County College. I also have Sharon McLean. She's on the phone listening. She's also an adjunct professor with Essex County College. We've been running a lot of meetings. A lot of our classes have been going over Zoom. We do a lot of Zoom meetings throughout the weeks. So that's kind of like a new thing to us right now, switching from physical classroom to Zoom. I lived in Newark.
When you get there, you got to wait till you get there.
Now, about 10-15 minutes away. And I pretty much stay in a lot, but when I do go out for like essentials, it's kind of different, the stores now, they're only allowing a certain amount of people in at a time. So we have to get there early because the line will be all the way down in the parking lot. They're making everyone wear masks and gloves. You can't even go in the store. You'd be waiting for hours to go in the store, and then a lot of stuff that you try to go in for, they don't have. So that's kind of a different thing. My thing too is I've noticed too is I was in healthcare profession many years as a medic. I remember every time we treat patients, we always change gloves and masks. And I'm seeing the same people wearing the same masks and gloves all the time, which is not a good thing because you're just cross-contaminating things. So that's another thing. And I think education prevention, this is something that were never prepared for, definitely the homeless population is very vulnerable with this. I live a couple buildings down from a senior building. I know a lot of them are vulnerable as well. So it's just something that, I don't think it's going to go back to a normal for quite a long time. And it's something that we just, are going to have to get adjusted. And a lot of the information, there's a lot of unknowns that we don't know about this virus. So it's just going to be a matter of time before, we figure that stuff out.
So I'm going to actually go back to Lili, and then from Lili go back to everyone because we are approaching our magic hour of 4 o'clock. So one of the things that the Newark Community Collaborative Board has been working on for 10 years now, we just celebrated 10 years a couple of weeks ago. And coincidentally, we celebrated 100 meetings, which I was shocked to know how many meetings one collaborative board could possibly, hold. But one of the things that we have been working on for a long time is a particular kind of intervention that we actually brought to the School of Social Work here a few years back, where we actually use images that we commissioned from a painter as one of the strategies that we use in the intervention to help people develop what we have been calling critical consciousness. And I would like to throw it back to Lili and perhaps, to Warren and whomever wants to say something for the last few moments. I think that critical consciousness, as we understand it in this group, is something that can help us in a number of ways. So my question is, how do we, as people who have been studying critical consciousness and have been engaging in critical dialogues, such as the dialogues that we had here today, to develop critical consciousness in order to do what? And so I'm asking that, Lili, to answer that question. And perhaps to guide us as we move to the end, how can critical consciousness be helpful in a moment of COVID-19? Then after Lili, maybe Warren will say a few words as well.
Sure. Interesting you asked this question, because this year I'm going to be very biased because I'm working in Congress. So what I say is that with critical consciousness, it's not sufficient to just be engaging in the dialogue with others, but I think that it's also really important for us to keep the action piece in mind and go beyond just talking about these issues. One thing that I have learned in my fellowship year is that what's happening in Congress with the polarization of the country and all of that is very much a reflection of the situation in which we find ourselves as a country. Sorry, my son just showed up. Leo, I can't, I'm talking.
Leo, we want to see Leo, Lili.
Hi,
Hey, Leo.
Okay, now I needed to
Leo.
go, okay? So anyways, it's a reflection of what's happening in the country. And I think that we have had that the communication has broken down. When we look at our own families, it's one place, and at our communities with our friends. And if we want to change the situation in which we find ourselves, we really need to get more engaged. We need to get people out to vote. We need to be diligent. We need to make sure that we're protecting people's rights and keeping the conversation going about inequalities, because COVID is just highlighting inequalities that already existed previously. So I think we need to act more than what we have been acting.
So we need to develop the critical consciousness and do something about it.
Yes.
Something with it.
Yes. Capacity.
Warren, do you have any thoughts about that?
I do. I don't know if you guys have been following the chat box or the chat room, but I think that one of the things that really, really has gotten me to think more critically about this is this emphasis of the test, right? Like, get the test. Like the test is, the end all be all, right? And as Lisa was talking, I started thinking about when I worked in the substance abuse arena, and you would take urine tests or breathalyzer tests on individuals, and that's only a tool, right? That's one tool that will indicate at that point in time, is this substance in this person, right? And I mean, you would have people that would take the test clean, but they might have drugs in their pocket. And the minute they finished the test, they would go and do the drugs, right?
Exactly.
I mean, I think that there's a huge emphasis, and I think we also have to be extremely careful of the messages we receive from politicians. I think we have to be careful of the messages we're receiving from the media in general. And I think that we have to critically think through all of that, because the test, all right, while it is a necessary tool, right, that's not the answer. There's things that have to occur beyond that. And I think the only way to bring about some sort of reason is to critically think about this, because you're really getting to a point that people are panicking because financially they're falling apart, right? And people will begin to take health risks, right, if they can't pay their rent, if they don't know where their next meal is coming from, right? So all of these things that are happening economically to people, right, are eventually going to increase the chance that people are going to not really take the necessary precautions to maintain what we need to flatten the curve, so to speak?
Well, because they may not have the resources that we are asking them to have, right? I mean, wear
Right.
gloves. Well, do we have the money to buy the gloves? I was having a conversation yesterday with a colleague from another university about, as we move forward, we have not been doing any human participant research because of, social distance and physical distance. But eventually, we would like to do that again. And the problem is, the protocols will probably change in that if you want someone to sit across from you, we need to provide the mask. We need to provide the gloves. We need to provide whatever protection we have for our research participants. So it's every day there's a new level of thinking and a new thing that we need to come to. And so what I would like to suggest is next week, instead of being this focus on a location, I think what I'm going to do, although I do want to invite someone from Brazil to join us, who's going to talk about the virology of COVID-19. And so that happens to be my my niece's husband, who has been doing COVID-19 research in Brazil, and including related to the testing. And I think it would be interesting to hear about the theories that we have as to how this virus came about, and so that keeps us with the science fresh in our minds, but also to bring up the politics of COVID-19. We have done a little bit of that a few weeks back, but I want to bring that whole thing back on, because it is based on this politics that we are going to be reacting or preventing as we move forward. And if we are just in the exercise of reacting to the politics of the day, a lot of us will die, because this is being so reactive and reacted to stupidity. And so we need to find ways one-on-one in our conversations to really combat it, in our lives, in our families, like Lili, talked about, and bring up the idea of critical consciousness, which is the capacity to determine who we are, and not to buy into the lies that we are being fed, every single day, and not to fall, for lies, which are so widespread. So it is photo 2. I just would like for Eddie to wave, her hands for a while, because she is my co-chair. And has been, you were not here like at the very beginning, so that's why I'm making sure to introduce you. Ed is my co-chair of the Faculty Alliance for Diversity. It looks like Jeanette has something to say.
I just wanted to say that one of the things that we were trying to do with, we have a lot of very, very low income people. And so I think, first of all, disposable everything is going to be terrible for the environment, right? We just kind of, and for people who are housed, and even if it's marginally housed, like we've been recommending they get like 14 reusable things, so that like the mask, and then kind of talking them through what cleaning that will be like. And I know everybody doesn't have the resources, but honestly, I just, as an agency, our ability to sustain like the supply side, we won't be able to do it, to give it to everybody every day. So we've been trying to give everybody 14 masks and 14 pairs of gloves. They're not disposable. They do have to be cleaned. But we can't do the daily thing. We just won't be able to. And I think a lot of low income, marginalized people won't. And so we have to kind of figure out what is a safe, reusable, and how does it have to be cleaned and stuff. But honestly, this disposable should be kept for like doctor's office or places where people are coming in, and if they don't have it, then you give them a disposable.
High contagion.
Yeah.
Thank you for saying that, Jeanette. Yes, and you give 14, and then how long do we expect it's gonna last, right? So many questions. So I'm inviting everybody to come back next week. I may be going back to guests from weeks past, and collect them all together to help us think about how does the comeback look like. I think it will be the question. Did somebody say something?
Rogerio, will you send out an email invite for next week?
Yes, everybody who comes as a guest gets an email for the following week and all the weeks that come. So, so I'm just basically deciding the theme. Next week we are going to talk about what do we do to come back, and to come back to what?
Okay.
So that's the theme, and I'm going to be asking some of the guests that already spoke in the past to create, you know, the guest list for next week. So everybody, I'm Rogerio Pinto. With Eddie Weaver, the co-chairs of the Faculty Allied for Diversity. I want to thank everyone for being here. I love you all, and continue the fight against COVID-19. Thank you, my guests, my beautiful guests. Thank you.
Thank you so much.
Mm-hmm.
Rogerio, thank you. Bye, everybody. Bye,
Bye.
Lili.